and this actually goes to your your background, Cameron. Um, I don't even know if we've had this full conversation about ICHRAs, but it's one of the reasons why, like, take my Presidio hat off, take my everything hat off, and just put my American father hat on, the country that I want my kids to grow up in. There is a revolution to flip the largest market in health insurance, which is the employer market, and to start to attack some of these competition issues, which is the market that you were heavily involved in, which is the
Right.
ICHRA market. Um, so, like, if for those who are not familiar with this, I really think that this is something that can begin to be the groundswell to kind of change some of this, which is, think about your retirement plan. It used to be pensions, right? You talked about, like, people talking about the good old days. The good old days used to be pensions, right? It flipped from pensions to 401ks, meaning defined benefit to defined contribution. In healthcare, we are in that defined benefit situation where the employer is deciding for every one of their employees what health insurance should look like. It's called defined benefit. There's a movement to switch to defined contribution where instead your employer says, how about we just give you the money and you, as the family, go out and purchase insurance that aligns with your values. You can think about the cost, right? This is a radical shift for what is 150, 160 million Americans. And, like, I think people have attacked it because it's in its infancy and all these problems with it, but they need to, like, step out for a second and think about this holistically, that, like, what you're doing is you're starting the process to train Americans to actually interact with healthcare costs. So instead of only 20% of the cost being elective, let's start to make it 100%. How do we shift half the country to make 100% of the healthcare stuff elective? Now you have a difference. Now you have a just starting from the insurance side and from the physician side. Now you have both the payers and the middlemen having to think about what is the value prop for every single family in America, as opposed to employers. And families, talk about, price elasticity. Families are much more price sensitive than employers, and so that's going to drive competition. Yeah, I don't know if you have any thoughts on your history with the ICHRA
A lot of
community.
thoughts. I mean, generally, like, we need to see some, legislative changes, both at federal and state level, to allow for, right, more competition in the ICHRA market. We need more more alternative products to be able to uh, drive, the cost sharing down, to drive, um, the premiums down. Like, there needs to be, more options for consumers that are more affordable. The I always say, like, the product parity is not there that you had in the pension to 401k shift. Like, if your employer is investing in your pension fund and it's in a Vanguard stock, you can take those same dollars and put them in the same Vanguard stock. You can't do that in most markets. There are some exceptions, but you can't do that in most markets from your fully insured, or even self-funded group plan to go find that same, right? Because the employer has designed a group plan with $1,000 deductible, which doesn't typically exist in the individual market that's eligible for ICHRA. Uh, and if it does, it's very, very expensive. And so, there are some, like, low deductible plans, but they're very, very expensive and they're just not affordable for most Americans. But I digress there. And I think it's interesting because you were you're talking about the employer. I mean, in the employer market, in your large group space that can afford to be self-funded, or a self-insured employer who's, paying most of the claims, if not all of them, up until a certain point, except for the high dollar claims, they partner with, like, a reinsurance carrier. Those employers are incentivized to these secondary issues, the opaque pricing, overbilling, um, helping their employees be good consumers of healthcare. The employer is kind of incentivized to help their employees do that. So as we see a shift to, ICHRA or the employers moving to the individual markets, I think it puts some of that onus on the carrier to empower and kind of equip their members to be good consumers of healthcare, right? And we could do a whole nother show on, you know, the racketeering that goes on within a health insurance company to like, control their own profits and have separate profit centers within the and drive their members to certain facilities that, drive more revenue. But that's a whole nother episode. So, not to get into that, but like, yeah, it's certainly we're still in the infancy stage. It seems like we should be, and I think most folks in the ICHRA space expected the shift to happen a lot more rapidly than it has. It's still happening pretty quick. Um, but I think they thought it to be like as immediate as the pension to 401k shift happened. It's going to take a little bit longer because it's going to require that free market competition. But yeah, to your point, um, I think we're well on the way to seeing that. It would be, we were talking about Medicare. It would be interesting. I was just listening to a concept around like the Social Security stuff and what they're doing with Doge, right? But and what their findings are and the poor management of like the Social Security fund not being invested in like, you know, the right assets to be able to like grow that fund over time. Like, it would be interesting if you could, garnish or withhold someone's wages for Medicare spend, but then return those dollars back to them at retirement age, to allow them to be able to choose competitive products versus just being it would be subsidized but completely funded by the government. Like there could be some plays there that policymakers could think about. But yeah, I mean,
No, stop. Well, I mean, stop on that for a moment. Like, yes, like
like
why? Because what would you have to? You would have to actually. Yeah, I mean, I think it's the difference between controlling versus empowering Americans to interact with the healthcare system, right? So, like, the Medicare system is we take your taxes, we take your money, and then we negotiate. We choose how to negotiate with hospitals, and we
right,
choose what benefits we cover, and then you just get the program when you're 65. Okay, like you're basically and it makes sense. Like if your employer pays your insurance from the age 18 to 65, it makes total sense for an American to be like, yeah, like the government then should take over at 65, right? But if you flip that and said like, no, 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 the government tries to allocate resources and kind of redistribute a little bit, but give you the money to go purchase your insurance, you would be an active consumer. But what I think there's like a step here, like to get there, if the employer market was like that first, then you would have people that are used to buying their own insurance their entire life. If you bought your insurance your entire life, you would be like, this is kind of stupid that I can't buy my insurance now that I'm 65. Right. So, like, I think that what you just said is exactly.
yeah, let's take your tax deducted Medicare dollars, invest them in a currently productive asset, S&P 500, for example, that returns 9 to 10% a year over a long period of time, and then somehow those dollars get redistributed to you for the purchase of, maybe it's a socialistic. Maybe I got to think about this. Maybe that's like a socialistic, uh, you know, economic play. Like there's some socialistic economics there, but those dollars are returned to you to purchase, you know, Medicare options, which may have some cost sharing subsidization like we have in the Obamacare market under 65, um, to subsidize the cost to the carrier. But you can choose a very like low premium because you're 65, you owned a business your entire life, you've got a few $1 million in the bank. You're like, if something happens, like I'm 65, I probably got like three bad rainy days left. I mean, I don't mean to say that. I want to be sensitive, but like, if something happens, I can afford the $10,000 out of pocket max. my grandma gets sick, like she just calls the ambulance and goes, and it's covered. She doesn't pay anything, except for her separate, parts of the part C's and whatnot, or her Medicare Advantage. But other than that, like you just jump on the ambulance and you go and it's paid for. And there could be an opportunity there to kind of reinvent, um, and, and maybe that's in some ways Medicare Advantage was meant to be, but that's a whole nother conversation. So that would
No,
be
because
like an
Medicare, yeah,
interesting
no,
way.
no, because Medicare Advantage is capped, right? Like
Right.
the government gives the carrier X amount of dollars. It's a different form of price control. It's the same thing, and then it's like who can manage the care better, but it's still under, like if Medicare had to pay actual cost in today's market, the entire program would cost 60% more. They'd have to jack up the rates 60%, right? So Medicare Advantage still has the capped. No, but what you said exactly. So I think, and what I wanted this conversation, like what I hope people get away from this is like there's two things happening. There's kind of the distortions and lack of free market that is our today's reality, and within
Uh-huh.
that, there's all sorts of like ways that you could maximize your savings. Right? I call these health hacks. These are health hacks that you can find ways to like, and there's people out there trying to help you find savings, right? And that's all great, right? But when we talk about American healthcare solutions, it has to tackle the 40% of Americans that are on price controlled care, and the fact that 95% of Americans have subsidized coverage, very people, right? These are the two principles. So I think what you said is something that I think is so important for like the healthcare policy world to think about, which is, it took 50 years for us to get to this point, and they're still trying to get that. They're trying to get into the end zone with a single payer system. It's taken a long time to kind of like break down the American healthcare system to make it centralized. It's going to take like 50 years if you want to reverse that. And so we can't let purity be like a roadblock for those that want free market solutions. Like you said, like, oh, it's still a little bit socialist. That's right. Like we should think of ways that aren't perfect, but like start to move the needle. And I think what's even more important is like training Americans to want to engage in the healthcare system, even if it doesn't produce cost
Yeah.
savings initially. Because
Well, you
the
got to
the goal of,
fix the overcorrectness, right?
yeah.
Like we
So like you
overcorrected with like too much socialistic funding of Medicare, right? Or Medicaid's a different thing, but Medicare, for example. And so how do we start retraining to like fix that overcorrectness, and bring it back? You can't do it like in your purity statement, right? Like you can't do it in one foul swoop. It's going to take a lot of time to bring it back. So, um, yeah, there's probably no shortage of like ways that this can be done. Um, but are we? I'm hopeful that some of the things that they're doing, our commerce secretary is doing, and they're doing on uh, you know, the things that impact like GDP. They're thinking about things in this way, and they're starting to think about things in this way as it relates to Social Security. I think Medicare is another, uh,
it's
is hopefully the next step. I don't know. I don't want to like. I'm not going to hold my breath, but yeah,
well,
you're
it's political dynamite. That's why I think that's one of the biggest